Well, good afternoon, everyone. Welcome. It's my great privilege, pleasure, and honor to welcome each and every one of you to the National Academy of Sciences and the Institute of Medicine. We're here to release the IOM workshop summary, core measure needs for better care, better health, and lower costs, counting what counts. There are hard copy versions of this pre-publication summary, which I hope you all got when you came in. They're out on the table outside, and they can also be accessed online afterwards at www.iom.edu/countingwhatcounts. We're also pleased that this session today is being webcast so that additional people can join us. Be mindful that that means that you are your every word, not quite your thoughts yet, but your every word is being disseminated across the nation. The folders that you received, I'll just run quickly through to draw attention to what you have. First is an infographic that's inserted in the middle of the folder on counting what counts that summarizes in graphic form the common themes that were heard throughout the course of the workshop conversations and emphasizes in very, very brief fashion the essence of the reasons for core metrics, how they can be used, the infrastructure that's necessary in order to move the whole process forward, the benefits that are anticipated, and very importantly, the current initiatives that are underway from which they will draw and which they will hopefully enhance. On the left-hand side of your folder, you have the agenda for this afternoon's session, followed by a list of the workshop planning committee members. This is an IOM workshop in which we appoint formally under Academy procedures the members of the planning committee. Our chair was Craig Jones, who you will hear from later on in the course of the session, and it was a terrific group of planning committee members who guided the overall effort. Following that is a list of the participants in the session, your colleagues here today, and after that is the speaker biographies of the folks from whom you will be hearing in the course of the afternoon's conversations. On the right-hand side is the one-page description on the top of the workshop activity, the one called Core Metrics for Better Care, Lower Costs, and Better Health. And following that is a one-page description of a follow-on consensus study on this issue that I'll mention a little more about in just a second. The flow of today's event, as is indicated on the agenda, is as follows. After a few short comments from me, we'll have the work's sponsor, Peter Long, from the Blue Shield of California Foundation, offer some reflections. Then Dr. Craig Jones will provide an overview of the discussions that were undertaken at the workshop. And after Dr. Jones' comments, we'll have a panel discussion with speakers who were drawn from the workshop, which I should say was populated by a really wonderful collection of experts, both in the development and the use of measures from around the country. And the planning effort here has identified three of the very best and most articulate spokespersons for the discussions that were undertaken there. For my comments, I primarily want to emphasize two things related to the unusual nature of this particular session. First is that this is a public session on a workshop summary, not a consensus study, which is not usual for the IOM. And secondly, this is a work in progress. On the first, we don't often hold public releases for workshop summaries. Oftentimes these summaries are very important. They're almost always informative and helpful in providing the context for important issues, but they don't offer recommendations. And we generally hold our public sessions on reports in which there are recommendations. This is different because it addresses what is clearly one of the most important challenges in the nation today as we move to a transformed healthcare delivery system. And we need to know where we're going, how well we're doing getting there, and where we're falling short or exceeding the mark. Last fall, the Institute of Medicine released this report, Best Care at Lower Cost. It is a consensus study that reviews the path to a continuously learning healthcare system. It's broad and lays out a vision for what might be achieved by the nation with respect to better care, lower costs, better health, more engaged patients. It also begs a question: how do we know when we're actually achieving those goals? What are the key measures to be used in assessing our progress? In addition, we see CMS working to develop and refine a variety of metrics that can be used to help administer the programs under the Affordable Care Act. If you take the issuance of the proposed measures for accountable care organizations as one example. Another example is what meaningful use identifies as the basic elements in electronic health records. Throughout all parts of this ever-changing healthcare delivery system, the notion of what we measure as an indication of what we do is a vital challenge for us all. So the important element that draws us to this public release of the workshop summary is that we have here an important terrain mapping contribution that lays out the resources upon which we can draw, as well as the challenges that need to be engaged. The second part that I want to emphasize is that this is a work in progress. Naturally, having mapped the terrain, identified a variety of the resources on which we can draw, the charge is now to engage the various resources and perspectives and drive home to a set of core metrics. So we have formed a consensus committee which will take this work and move it to the next stage, working with you in this room and working with those who were involved in the workshop activities and working with those who are doing such important work around the nation on various elements of the measurement landscape. The committee that will undertake this follow-on effort is in the approval process, but advanced work for that study is currently already underway. And actually, mentioning advanced work reminds me that I need to make a comment about who's doing that work. Rob Saunders, back in the back there, was the program officer as the point person for Best Care at Lower Cost, as well as for the Core Metrics Workshop, and will be for the follow-on consensus study. And the team that he's worked with, an extremely able group of people, first and foremost, in many ways, Julia Saunders, who is right here to my left. Also, Liz Johnston, who I believe is outside, and Elizabeth Robinson, I don't know that I've seen, but she's probably here somewhere, as well as Valerie Rohrbach, Barrett Zimmerman, and Tiffany Cheng. So thanks to all of you for the great work that you've done. This brings me to the point of introducing our sponsor, but that term vastly understates the contribution of Peter Long to this activity. Peter not only was the sponsor through his presidency of the Blue Shield of California Foundation, but the inspiration for this set of activities. Both the ramp up with the workshop and the exploration of the terrain and the mapping of the prospective need for a consensus study, but also in fact, this notion came out of a conversation that we had probably about a year ago, I would guess. He not only underscored the importance of this effort for the constituents whose welfare he is stewarding with the grant-making activity of the Blue Shield of California Foundation, but the importance of the IOM helping to pull together the necessary work. So, Peter, I want to thank you very much for your leadership, for your partnership in this effort, and welcome you to the podium.